going to say today we're talking about fibroid surgery and recovery. And before I share any of mine, a few questions that I wanted to ask. You know, I know we've talked a lot, and you've shared documents, you've shared voice notes around fibroids and a lot of stuff. But today, I'd like us to go through some of the things. You know, so my first question to you today is, what are the common symptoms of fibroid that might indicate that there's need for a surgery? At what point, you know, when a woman is suffering from fibroid, do you then recommend or come to a conclusion that you're recommending surgery?
Right. Main thing is heavy vaginal bleeding, which makes them so anemic, nothing can help out. That is very important, as well as painful period. And the second thing can be fertility, which can be the reason, and fibroid can be the reason for that. Third thing is a pressure symptom on the bladder, on the bowel, and on the nerve. I have seen ladies which they can't walk because the fibroid is pressurizing. We just had a patient who she had nearly renal failure because the fibroid was obstructing both ureters. So the pressure symptom is not just a simple thing, or they have to go to the toilet every 10 minutes, 15 minutes, so that because of the pressure, or they can't. And the size. If the size is too big enough, which affecting sometimes it just the women. I remember when one of the women was on the table after anesthesia, and everyone was saying, "Are you sure she's not pregnant?" I said, "No, this is a fibroid. This is not a pregnancy." So these are the reason, and also, of course, if there is any suspicion that there is no tool in the world to tell us if there is no suspicion this fibroid. The fibroid can be, there is 50-50, some 50% of the fibroid you can see, oh, that's a benign fibroid, nothing abnormal. But some of them, they are really suspicious. When it is suspicion, then that's some point that you have to operate on. So these are the reason where most of the time people go through the surgery because of the fibroid.
Right. So that's at the point where you start to say, okay, you're recommending surgery, myomectomy or hysterectomy or whatever other type of surgery that there might be for fibroid. Something that I would like to get to today. You know, in my case, I had to have hysterectomy, you know, but that was after a long deliberation. Honestly, maybe I only took that way out 2 years after I'd first been offered. And if I knew the things that I know now, honestly, I would earlier on, even when it got really bad, I would have started an alternative lifestyle, if you like, and found alternative ways so that I can avoid hysterectomy. But because I left it so long, I dragged on, and other things happened. I found myself in a situation where it was life or death, because it was either that I was going to try and save my uterus and bleed to death, or just get rid of it.
And the other reason, of course, as if you left it for a long time, or if you tried everything else and didn't work. For example, lifestyle, medical treatment, minimal excess surgery, like which we do embolization and tablets and everything else, and injection. If you exhaust every single reason which can cause the fibroid to diminish or become smaller or have less side effect, then if nothing you can do anymore, that is also the reason for the fibroid. Either you take the fibroid away according to the age and situation of the patient, or you say enough is enough, you take the uterus away, and that is what is it.
Yes, and sometimes also the positions of the fibroids, isn't it? Because I know that with mine, I actually explored every other option. Honestly, I did try because I was like, oh no, I'm not going to try and get rid of this situation. I did try to save it. Nothing worked. And then
Yes.
at some point, actually, I was hopeful for embolization, and I was actually going to be a case study in some trust that I'm not going to
Yeah.
name, you know, and they were looking for funding seriously, and they were just going to make me, you know, that guinea pig for their funding. And I was happy to do it, honestly, and go along with it, only because I also just was looking for any other way apart from
That's true.
having
That's true.
hysterectomy, you
Yeah.
know. But at the
Yeah, the
last minute, you
position of the fibroid is very
know,
important. I had a lady on Monday where the uterus, very small, sitting on a football, just sitting, which is supracervical or cervical fibroid. You can't take it out. You cannot take such a fibroid out, because if you take the fibroid out, the uterus will come off with it,
oh,
whether the patient agree or not agree. So that is
it was a
another
done
type.
deal. Wow.
That's but she was 55, so that is, and we decided for hysterectomy anyway. But even the imaging, no MRI, no ultrasound, told me what was the position of the fibroid.
Wow. And that's
Believe
another
me.
thing. Some of these scans, you know, you can only see some. And then
Yeah.
actually when you get to surgery, you
Yeah.
see that, oh my God, it's
Yeah.
not the numbers that
Yeah.
you thought they were. They're
Yeah.
bigger, or the positioning. I know.
Yeah.
It's really, really, really
It's different. It's different. Whatever imaging you have, yeah, there are some radiologists, they report it nicely and in a good way, but other radiologists, they just say posterior fibroid, anterior fibroid, lower fibroid, but when you open, oh my God,
I know.
it's
And
very different.
someone recently told me how they told her she had about
Mm.
maybe 5 or so.
Oh, yeah.
And then she opted, yeah.
Mm.
And then when she had the surgery, they came out with 14 or something. I was like,
Yeah.
what? You know? So I mean, those are the things.
75, 102.
500.
75, 100, and also another time 125.
From one person, Mr. Man.
From one person, 125 fibroid. Yeah.
Jesus.
Yeah.
Wow.
Yeah.
Wow.
And I had to take the fibroid oil because she wanted the fertility.
That's the thing, is not always
It's
so sad.
not fair.
Yeah.
I have done a laparoscopy for a very young girl. Imagine 22, 2 weeks ago.
20.
Just my heart, she's 22, and my heart sank when I have seen so many fibroid. And in addition to that, stage 4 endometriosis. Why? God, 2 gynecological.
22-year-old.
She's
Wow.
22 and she has pain, and I was told that's just a fibroid. I did a laparoscopy for her to see where is this fibroid. Everywhere. And then on the top of that, severe endometriosis. Why, God? Why both?
Oh no. Oh no. Okay, quickly, before we
Mm.
jump ahead of ourselves, I
Mm.
also wanted you to explain the different
Mm.
types of surgeries
Mm.
that's available to treat fibroids. Honestly, what are the options that women have? Because
Yeah.
sometimes
Mm.
I'm a strong believer
Mm.
of find out what your options are and explore
Mm.
the options.
Mm.
See which one. Because
Mm.
for every woman is
Different.
different. See
Yeah.
what's your
Yeah.
best, you know, combination. See what's possible, what's the best possible solution for you based on the outcome that you
Yeah.
expect and your age and all of those
Mm.
kind of things. So
Yeah.
please tell us the different types of surgeries that
The different type of surgery is depend on a different type of fibroid.
right.
If you have one fibroid sitting inside the room of the womb, which we call a submucous fibroid, but by chance, unfortunately, not everyone have one submucous, which is called type 1, sitting in just attached to the wall of the womb from inside. That type of fibroid we can do, it's called hysteroscopic resection, where this is a minimal access, minimal invasive. We put a camera and we do some, it's like how the shuffle is take the things in the ground. You are shaving it with the electric machine. So can be one stage, can be two stage, can be patient come back to remove the rest of the, but because if it is big enough, then you have to prepare the patient with the injection or a tablet to make it a bit smaller, and then you take it out, and still sometime because that has a risk. If you go further, you may make a hole in the worm. May, because, and also using water, using normal saline. If you take long time, this fluid is go to the lung of the patient, which call a pulmonary edema, can go to the brain. So you have to be careful how long you are doing this procedure and how much fluid you have to have in and out. You have to have people, the team supervise and warn you, you made more fluid. And then sometimes we have to give them an injection to the fluid to come out from their body through the kidney. So you have sometime one stage, sometime two stage. If you hear from the doctor saying, I couldn't do it all, but you have to come back in a month or 2 month time to take the rest. And in addition, this is called type 1.
So my mactomy in 2 phases. Is that what you're saying? You take some and then, oh wow.
Because this is inside the womb. And then sometimes they are not only type 1, it's a type 1, type 2. Type 1, type 2, it means like a tree. How there is a root in the ground, some of them, they have a root in the wall of the womb. You take the one inside the womb, then the root, it grow, it become obvious, then come back and grow.
Jesus, are you okay?
I fell. The chair, doesn't matter, I'm fine. I'm fine. Yeah.
Sure?
So no, I'm fine. So then the root, when it grow back, and sometimes we have a complaint from the patient saying that, oh, I had by such a doctor and that doctor that we have the floor is better. So that I have from that doctor, she told me or he told me that I took all out, and then about 6 months down the line they did a scan and there is still fibroid in because the root, it grow into inside the womb.
Wow.
So then you have to do second stage procedure. And I have seen, unfortunately, doctors between us sometimes they talk about each other. They say, oh, that's not been removed by them. That's a lie. They removed some, they left some. They don't explain to the patient. They say, oh, this is the reason. Because even ultrasound or MRI scan cannot tell us what is what.
All of it.
Yeah, cannot pick all of it. So this is one type of the surgery which can have. And sometime I have seen it is like on the pedicle, like on a stalk.
Right.
It comes down from the womb to the cervix to the vagina. And often these patients being referred as if like a cancer. But you see, no. It is come down and it is like hanging. How the chandelier.
What's that one called?
That's also submucous, but on a stalk. Yeah.
Oh.
So still what we do, we just cut the stalk, and then the patient, and most of the time they come with a vaginal discharge and infection, and because it is inside the vagina, they get infection. Right. I had 2 patients in 1 year. They thought it is a cervical cancer, but I found out it's a fibroid on a stalk.
Oh.
Yeah, so that is another one, but it's all minimal invasive through the hysteroscopy, which is just put through the vagina and through the neck of the womb, and then you take out. That is one type. And it is very good for the people if they have infertility, if they have heavy period, if it is only one fibroid, heavy period and infertility, they get pregnant and it's not such a problem. That's one. The second one, it is inside the wall of the womb, which is called intramural. As I said, there is very rarely you have one type only. Either is bulging out or bulging in. The one inside the wall of the womb is depend on the size. It may increase the surface of the womb and cause a lot of heavy bleeding, a lot of pain, but really doesn't interfere with the fertility too much, unless if misplace the tube or ovary from direction. If it is growing under the tube or making the tube away from the ovary to get the egg through, that is the only one. But the treatment for that It depends, of course, on the size. If the
Right.
size is medium, small, you can have it through the keyhole surgery to be removed and sutured. If the size is too big, you have to open. And the other one, which is sitting like on the roof. And again, if it is small, I have seen women come in with 1 centimeter, 2 centimeter, 3 centimeter. They are afraid of that. That's nothing. Leave it forever. And also the blood going to those type is very minimal. But if it is too big enough, if they are pressurizing, as I said, on the kidney, on a bladder, on a ureter, on a bowel, then again, you can have a keyhole surgery and you can have open surgery. But keyhole surgery is a bit now not allowed too much.
Why?
Why? In the past, we were more selective. Mince it. You know, you take the fibroid inside the tummy, then you mince it. And when you mince it, you then take it out with a machine. They found out there was a nurse in America. She had that. They didn't know that is a cancer. So when you mince it, some pieces of it go inside the tummy. And poor women had cancer everywhere after that and sued, of course, everyone involved in her care. And from then, unless if you put the fibroid in a special bag and you mince it inside that bag and you take it out through the bag, we are not allowed to mince it just freely. So that is that needs really time, and also the keyhole sometimes cause more bleeding and sometimes may cause not taking every single one out. Although the keyhole surgery is brilliant, doesn't cause a lot of scarring, but the open surgery causes scarring, of course, more scarring than anything else. So that is about the myomectomy.
So,
and then according to the age, how younger the patient, how better the myomectomy. How after age of 45, if the woman finish her family, safer to take the uterus out than with the fibroid than leave the uterus. Because if this woman carried on bleeding for some other reason, needed a hysterectomy, the most difficult hysterectomy is if the woman have a myomectomy before, and especially if they have a lot of fibroid before removed. It caused a lot of scarring, and happened to me once. I couldn't even open the tummy to go in and take the uterus, because then the growing and growing of the fibroid causing more scarring, and the scarring from before, and happen a lot when the women have operation in Nigeria and Ghana. I have seen they take the big one, they leave the small one, and then they grow again and then go back and do them. It's really, really difficult.
And to be honest, and I'm an advocate for fibroid, and I always say myomectomy is a short-term fix. If you go back to the same lifestyle, if you're doing the same things, they will grow back. The fibroids come back. They grow back. You know, there was someone I was supporting. She was in Nigeria, and she had myomectomy. And maybe less than 1 year, and she was recommended another one. I'm like, no, you know, and you have to change your lifestyle. Myomectomy does not mean that, you know, once you've had it, that's it, you're free. No, it's just, and like you said, so they'll take the big ones out and leave all the small ones. So that ones are still there
and grow again.
To grow if your lifestyle, you know, has not changed, if you're not doing anything about it. And that's the education that, you know, women need to be aware. Women need to be told. Myomectomy is not permanent fix, you know, even though I'm not saying hysterectomy or any other kind of one. Every kind of treatment has got their own advantages and disadvantages. That's why it's important to explore all your options, see what you have, put them on the table, see the pros and the cons, and decide which one is best suited for you. You know, before you go on further, I wanted to ask you about I know you've told us about the keyhole surgery, the open surgery, you know, for my mactomy. Before we get to hysterectomy, I wanted to ask you about this treatment that I've heard a bit of. Even yesterday, I was on someone bless us. I was listening to her conversation. She's also a fibroid advocate, Dawn Hill, and we're talking about the Sonata treatment. And I don't know if you know anything about that Sonata treatment. And
that is available in America.
So that's only, it's not available in the UK.
The radio frequency, they are on research in England, but in America they use it. But you know, everyone, if they use something, they put the data that is marvelous and good. But how much that fibroid can become smaller, we don't know. It's not available as a research project. Is available in England, but not as a. It's not been advised by NICE guidelines. It's not been advised, yeah. But in America, they use this because, you know, it's a private, it's a payment, so they use it quite. And also, I have seen it in India. We had a conference in June. They were talking about it because they have also a lot of private treatment, practice. In India also they're using it. Yeah, it is possibly, it is one of the treatment in the future. You never know, because these things can everything start from the beginning, which not everyone used it, and then they found out. But I know they use it. Yes, it's available, but not here.
So apparently, it's using some high resolution ultrasound, you know, to get to the uterus through the vagina. So no cuts, nothing, and then you're blasting, and then you're blasting the fibroid.
The fibroid, the fibroid. Yeah, so it is available in certain country, but you know, in England there is a lot of rule and regulation, and not everyone can just use. Have to be NICE guideline approved. If NICE guideline not approved it, then there is no way to use it. But when it becomes too popular, when it becomes too successful, it will be available.
Absolutely. Okay, so it's still a project. It's still a research project here. Interesting. And I'm sure people I'm sure if this was 3-4 years ago before I had my surgery, I probably won't want to be a project on that. Research try that out. You know.
I mean, 2 years ago we did not have the tablet. Some people now they use a tablet and they're happy with using the tablet, even with the menopausal symptom they suffer. They don't want a surgery. That's fine. They have a tablet, and tablet is working. I have 2 patients. They coming back for repeat prescription, and they're using it and they like it. So these are the things. But what we don't know, if the tablet stopped, what will happen? Is that grow again? There is a high possibility it grow again. And how many how many years you can repeat the tablet. So these are the things. Yeah.
And anyone, if you've got a question for Ms. Omar, please put in the chat, and then we can ask her. So we've talked about the surgery, different surgeries that are available for fibroids, and again and again, I will say explore all the options. Don't let anyone shove anything at you to say, oh, you have to have this or you have to have that. Please get information, get educated, do your own homework when you're going to see your healthcare provider. Go armed. Go with your own information, because you've done your own due diligence.
Go with the information and challenge.
Absolutely, and challenge, you know, the things that they say, because it's your body, and you're going to live with it, you know, for the rest of your life. And we'll talk about recovery in a moment, but honestly, get educated, get informed, go to your appointments, go to see your doctors, you know, haven't done your own due diligence, know the options available. Don't let someone say, oh, just do myomectomy. And if myomectomy is not right for you, they just take out the big ones, and you're still, you know, struggling with
I have seen people left chickpea size. Chickpea size, when they left, they become in a year or 2, it become like a football size, it's an orange size. So don't, and my advice to anyone, if there are doctors and listening to me, please remove anything you see, from the pea size to whatever the size you're removing. Don't leave because it takes long time, exhausting. Myomectomy is exhausting, take long time, can be bleeding. So some doctors, they are afraid, they want to finish, they have an hour with the patient. Quick, please remove as it is, be seen and be felt. That's the most important thing. Anything you feel it is like a fibroid, remove it, because you're giving a big things to the patient.
Wow. It is, I mean, I guess it's patient care, honestly, just putting patient first. Because, well, and also on the flip side is just, when, like you said, the scan and the MRI will not capture most of it. They tell you, oh, you only have 5, they can only see 5 in the scan, and then they open you up, you said you found one,
hidden.
something.
It's like you know, hide and seek, when people just hide themselves. If these fibroids can hide one behind each other,
Wow. So when you open up, you find a different kettle of fish. But honestly, get educated, get informed, know what your situation is, ask questions, challenge, what you're being asked to do. And if it's not the option that sits well with you, explore different options, is my take. Thank you, Dr. Omar. Thank you so much. If anyone's got any question, please put it in the comment. Let's ask Dr. Omar. Well, I wanted to get to recovery. And of course, so I had hysterectomy. The surgery I had to do was hysterectomy only because, again, I left it too long. I was dilly-dallying. I didn't know much about lifestyle change because I was still doing everything as I was doing. I was just trying different treatment that would work for me, and most of them didn't work for me. And until I actually even went and triggered by my lifestyle, triggered, the growth of the fibroid and the bleeding and all of that. And it became a matter of life and death that I had to, make a choice to either leave or get rid of the uterus. And I wanted to leave and see my children grow up. So I thought, okay, I'll get rid of the uterus. So, but that doesn't have to be everyone's outcome. Honestly, it's important to do your own due diligence. And that's why even FHF, we're here to support. If you want a second opinion, reach out to us. We'll arrange a consultation for you. Holding other women who I've gone through similar things, can help you, support you while you're going through and all of that. That's what we are here for. We want to serve, we want to help so that the women don't go through the same thing that someone else has, survived. You can have a different outcome. You can have a better journey because you met someone or someone who is in a community at their own journey. You will start to think different or see how you can approach it differently. Let's talk about recovery, Dr. Omar. So what's the typical period for fibroid?
If it is, as I said, it is the minimal invasive one, which is the type which I said, that is not just a week or two, just heavy bleeding, some pain. It is not that big. But the one with the open or laparoscopic surgery, again, a keyhole surgery, the recovery also take 2 weeks at least, and also depend on the bleeding. If the woman be well prepared before the surgery, well nourished, well iron level, no need for blood transfusion, this recovery will be much smoother. If the woman had lost a lot of blood, need blood transfusion, it will be weaker. So the recovery will be much, much longer. We say average 4 to 6 weeks, but depend on, of course, it is a wound, infection. As I said, if the bleeding too much and needed blood transfusion, or pre-operative have quite traumatic time and having a loss of blood and needed blood transfusion. So the women's body are weaker. So how much it is stronger, how much the recovery is quicker. How much it is weaker, how much the recovery will be slower. And more vulnerable to infection, more vulnerable to not recover very well. And also help. I mean, in the house, they need help. Women by nature like to be around, doesn't want to be sitting around, don't want to be involved, but they have to not lying down in bed all the time. They have to be up and about, but take it easy, especially in the first, second week. They take it easy, then start walking around, going out for like short walk, and coming back and doing a little thing, not hoovering, not washing and cleaning or ironing. So it takes 6 weeks at least.
Okay, thank you.
Yeah.
You know what you've just said now got me thinking around. So because depending on the body, on how the immunity has been built before the surgery, is how what affects the duration or how long recovery will be. So I wonder if it will be useful to also give this kind of recommendation or advice to women, like a pre-surgery kind of advice or pre-surgery consultation, where women have to be informed, educated about, look, you have to build up your immunity, you have to do this kind of things or that kind of things, eat like this, or you know, this group of food to help you be able to heal quicker. Because I say that because, you know, now talking about recovery, another friend of mine who had hysterectomy in America, I couldn't believe, because the same day of the surgery, and she was up and talking, she was up and about. And I know when I had mine, even though it was open, I was very, I was not
weak.
always,
Very weak.
I wasn't able to move around a lot, and it was torture to even go to the toilet. But she was up and about.
Yeah.
And I said to her, how come your body? She said, because look, I was intentional before the surgery. I started to eat certain kind of food. I started to do certain kind of things because I knew that it will help my recovery. I said, why are people not telling women about this thing? Because personally, I didn't know anything like that. I didn't know I had to do some certain things.
And you also you were anemic quite a lot, and you lost a lot of blood, and you had repeated blood transfusion, and that is also not helping. And when the bleeding is less, is only a fibroid and only this pressure symptom, these are very different. The body is much stronger. But if you are anemic, anemia is worse because it causes infection, it causes you not having any ability to walk around.
Oh God, that was, I'm going to share my recovery in a bit, but honestly, I'm just thinking it should be a thing where women have this pre-surgery,
pre-surgery preparation.
So that women are aware that eating a particular group of food, doing particular things will help recovery, make recovery quicker after the surgery, if your choice is to go and have any of those surgeries done. That should be a thing, and we will see how that will go. But honestly, I'm happy to
different from one person to another. I have seen people, they call themselves sporty fit, and they are just go down after surgery, mentally, physically. And I have seen the biggest women, not fit, never have done any exercise, up and about straight away, and it's different.
So I guess it's different. A balance of having, you know, eating the right food, doing the right kind of things, but also having the mental, the kind of emotional, physical support that you need to balance it out to be able to have a good recovery, isn't it, even after surgery?
And still the name of hysterectomy, even the women agree to, because they have no any other choice, but nobody want to have it. So that mentally, it affects the recovery. Yeah.
It took me 2 years
to go over it.
Before I had this. I didn't want to have hysterectomy. I'm like, no, I'm not having hysterectomy. For what? You know? And all of that. But
and especially in your culture, is not norm. People talk about hysterectomy easily. And even the one, I had 2 ladies came from Nigeria, and they had a hysterectomy, and they even didn't want me to write a letter saying that women have a hysterectomy.
Oh no.
Yeah. So imagine you going back to the country, you had a hysterectomy and you can't talk even about it.
Yeah.
So yeah, so it is that how
It's a
mentally you can be recovered.
stigma, yeah, it's a stigma, isn't it? And
Yeah.
also
So
our
how
culture.
mentally you can be recovered. Mentally you will not be saying, oh, to the people, oh, I have to have this because I have the hysterectomy. You have to say, oh, it's the minor surgery, and people laugh at you if you say I'm in pain. No? So these are the
Wow.
things which is
Wow.
important.
The
Yeah.
things, absolutely, I agree. The things that
Mm,
women have to deal with, but also
mm,
it's a stigma, isn't it?
mm,
Because one,
mm.
you know, you look well, you say that you've had this done, everyone starts to say, oh, well, I
Yeah.
guess it's also the culture
Yeah.
where we've come
If
from,
you
where I
be
have come
able,
from.
if you be able openly talk to the people and say, that's what I have. Always someone come up, especially with the social media, say, oh, I had the same thing. You need this, you need that. But if you can't talk about it, how you can have that information?
Before,
Mm,
before, before
mm,
I had my hysterectomy, honestly, and before I talk about my recovery, um, I was so scared because I didn't know anyone.
mm,
I literally did not know
mm.
anyone who's had hysterectomy
Yeah.
because we come from the culture where we don't talk about it. We're not,
Mm, mm,
encouraged to talk
mm.
about this thing.
No.
Everything's hush hush. So I
Yeah.
did not know anyone who's had it. So I
No.
was like,
No.
how am I? Because my concern also was, how am I going to feel after? Is it
Yeah.
going to change? Am I going to,
Mm,
like mentally, is it going to take
mm,
something away
mm.
from me that
Yeah.
I will like feel differently?
Yeah.
I just had so many questions and
Yeah.
I didn't have anyone to
Mm,
answer. And bless her, Inse,
mm,
Etiekwe, I think, I hope I pronounced her name right. Honestly, my
mm,
husband found that video and said, oh, look at this woman. She's talking about how, she had adenomyosis and she had to have
mm,
hysterectomy,
mm,
and I look at her like, she's like my age group and all of
mm,
that. And so I listened to her and she shared
mm,
her journey and
mm,
everything.
mm.
And honestly,
Mm.
that gave me some
Yeah.
courage. That was the only person, that was the only
Yeah.
video or the
Mm,
person that I knew that had
mm.
had hysterectomy. And I said,
That's
okay,
true.
God, if you can help this woman, if you can
Mm,
help her, then you
mm,
will help me, because
mm,
mine was really bad.
mm,
It was either that
mm,
I
mm,
had it or
mm,
I
mm,
had said, the
mm.
anemia got really worse, isn't
Yeah.
it?
Yeah.
So that was the only thing. And that's because one woman
Mm,
shared her journey,
mm,
and
mm,
was courageous enough to talk about it. Was
mm, mm,
why I had some courage when
mm,
I had to go through
mm,
mine
mm,
to do. But even after I finished, honestly,
mm,
I was going to be also in that category. I was
mm,
going to just withdraw because
mm,
I
mm,
didn't know how people were going to take
mm,
it. But I just thought people were asking me. So it was, I think, after many weeks of not going to church, someone asked me in church, "Oh, we haven't been around. Where have you been?" And I
mm,
was initially I was going to dismiss it and say, "Oh,
mm,
I'm okay. I was fine." But I thought, I wasn't.
mm,
I was. So I said what I did. So that, oh,
mm.
why? So I
Yeah.
explained to her fibroid and all of that. And this woman said, "Oh, I have similar thing." And that day, 5, 6 people
Mm,
were talking to me about fibroids. And I'm like,
mm,
what? So you mean a lot
mm,
of people in this?
mm,
I thought I
mm.
was by myself. I thought no one else is
Yeah.
going through what I'm going through. But that's
Yeah.
not
Yeah.
true,
Yeah.
honestly. And
Yeah.
we need to start to talk about these things more to
Openly.
help the next
Openly.
woman,
Openly.
you know,
Openly.
to
Yeah.
be able to build the courage to do the
Yeah.
right thing, especially if it's
Yeah.
the right thing for them. I'm not
Mm,
saying surgery is right for everybody. It's
mm,
not for everybody.
mm,
Look at your options,
mm,
explore it,
mm.
and make sure you choose right based on your
Yeah.
situation,
Yeah.
you know.
Mm,
And down to my recovery
mm,
journey. Oh my God, Bisoma.
mm.
Oh,
Gone
the
over
beat
it.
for me was between after a few days after the surgery, and
Mm,
I
mm,
was coping and trying
mm.
to. It was even difficult to to pass gas. It
I
was
know. I know.
oh,
That is the most difficult thing you go through. Yeah. Yeah.
it
Mhm.
was luxury. The
Mm,
pain that came with that, you know,
mm,
and
mm,
honestly,
mm,
also the issue of bladder and pelvic
mhm.
floor exercise, that
Oh my
was
God.
for
Mm.
me because I was like,
Oh,
I'm too young to
oh,
have this kind of
no.
issue with my bladder.
Yeah.
I need to
Yeah.
be doing something,
Yeah.
And so I was on the clock with my pelvic floor
I
exercise because
know.
there to see change, and that worked, you know, and all of that. But it's the beat of the finding myself in the hospital again 1 week after, where everyone, well, not everyone, the consultants started probing. They didn't know what was wrong, and I was back to this place where I wasn't losing blood physically, but when they do the test, the blood count was diminishing. And I was on the verge of being reopened again after 1 week.
Yeah, that was
just get in there and see what the problem is. For me, that was difficult. That was a nightmare.
Yeah, it's not easy. It's not easy.
When the anesthetic, what do you call them? The ones who administered that. When he came to me for the second time to be able to, you know, and I thought, you know what? Why can't I find what the problem is? Why am I losing blood? You know, that was difficult time. And when that episode where before I got to the hospital, I actually thought I was losing my life. It was that bad, you know. And so recovery is different for different people, and those are the things that I'm also saying. Please consider the recovery. And like we said, it's about finding that balance. You need
and before
food,
operation, prepare
right
yourself much better.
You need the right activities. You also need the mental, emotional, and physical support after surgery.
Yeah, that's true. That's true. That's absolutely true.
Because sometimes people are it's important, especially people if you're a single parent. All of these things are
how you can do that. It's difficult. It's very difficult.
Sometimes even married couples, because the partner does not understand how to help you, because
or have to go to work.
Frustrating. It can be frustrating. And sometimes the men will not know how to help you. They don't understand, because they're like, I tried my best, but you are miserable. You are in such a situation, you know, and these things that honestly we consider. But as I say always, every woman's situation is different, but there's hope. There is hope. Just knowing what your own situation is, making sure you find the right support network, the right system. You know, it was only after my situation that I started to mentor people who were going through hysterectomy, and I became, you know, maybe because I'd been through it, I will run errands for women around me who were not too far locally. I will go and do the shopping. I will go and bring you this, that, because I understood what it meant to be in that position after the surgery and recovery. It was important that you have the right kind of people around you, the right kind of support. You know, so it's really a tough one for women, but there's hope.
It's a journey. It's a journey. It's a journey.
There is hope and there is help. There is help. If you are considering that, if you're trying to go along that road, honestly, reach out. There are other fibroid advocates. So people are happy to help. Unlike back in the days when I had mine, there was nobody talking about it. But now more people are open and talking about it.
I think we made it through also this website and Instagram. I think even patients come to me and saying, oh, we looked at Instagram and we understand what is the problem, and when there is more information around and more people aware of the consequences. And
absolutely. And I think it's because more people are talking about it, so people are putting out information more and more out there now, you know, unlike many years ago. So there's information out there. Reach out, get talking to people, get into communities of women who are talking about it, who are doing stuff about it.
I mean, certain area, there are more race when they have the same problem. For example, if you go to area around Lewisham Hospital, 70% of the women, they attend the gynecology department, they have fibroid. So even if they sit in the reception, they know what is it. Croydon area is the same. But some area is basically very rarely you see one or two. And it's not only about the black race, even the white one. I have seen the white one, if they have it, they have a bit bad one. Most of the time, if they have the fibroid, they have a bad one. It's not like a simple one fibroid or something. They have more one. But certain areas, as I said, even they have a dedicated fibroid clinic because of the number of the patient attend the clinics. Yeah, yeah. So these are the point, which is preparation, understanding everything, understand where it is, why it is, how many it is, and what you're complaining about.
Having all those information is useful, and you
it's
go
like
also.
anything else. It's like anything else. You don't go even. It's not like you buying a dress and you can take it back if it's not good for you. If you've gone through the surgery, this is a surgery. It is a surgery, and you're going through it. You have to know everything about.
Absolutely, it's important to be aware, to be informed about it. There's a question here. Is there a place for laparoscopic scar removal a week after my myectomy?
Removal? Well, is that keloid, they mean? Is that making the keloid scar?
She said, is there a place for laparoscopic scar removal a week? Maybe they have keloid and they want to remove it.
There may be keloid. Keloid will not form after a week or I mean, the healing process. But unfortunately, it's the same thing. The connective tissue in a black woman is very, very dense. So the scarring is if you have a cut and cause keloid, when you have any operation, warn the surgeon, because there are injection we put, and also there are things we use to reduce the amount of keloid formation. It doesn't make it not happen, but there is a possibility you can do things like we glue the area, we put a stitch quite under, and we do injection at the area to reduce the amount of keloid to be formed. But if it is formed and you go for excision, nobody can guarantee that will not happen again on the next, because it is you excise it, then you have a stitch again. But nobody can guarantee, because maybe again it's caused keloid. That's the scarring.
Okay, thank you for answering that. The other one says, is it safe to remove a cyst or fibroid obstructing the ovary or tube during my myectomy surgery?
If there is a cyst, is better what type of cyst, how big the cyst. If they do a myectomy and there is a cyst in the ovary, we usually remove it if need to be removed, because cyst is about the size. Some cyst, if it's small, you just open it, drain the fluid. Some cyst is big enough, then you have to take it off while you leave the cyst for the woman already having a myectomy. It's not fair because it increased in size, then she had another operation, so you would say,
I guess. I mean, that makes sense. Thank you so much, Dr. Omar. I see if, we talked about this. How does the choice of surgical approach impact recovery process? We've talked about a bit of recovery. What are the chances of fibroids recurring after surgery, and are there ways to minimize this risk?
It's as I said, if the surgeon removed every single fibroid, the chance of recurrence, it will be 5%, but there is always a chance some fibroid hidden inside the womb or the tissue. It is like they call a fibrous tissue, can form again, and depend on the age of the woman. If the woman in their 30s and you take the fibroid, there is more possibility they have more fibroid again, because they still have the hormone, they still have a growing inside the womb. So the chance is have two way. Either that womb is just making a fibroid sometimes. It just growing the fibroid over and over. And some more, the other things which is possible, the small one is not being removed and then they regrow.
Back. I mean, it reminds me of the 22-year-old one you just said.
Imagine.
So I mean, what's the hope for that? Is
very difficult.
It has to be a lifestyle change, because I don't understand that.
She is tiny. She's tiny.
Wow.
She's vegetarian.
What?
I tell you, the girl is by the book.
And she's
But
got
just unlucky.
fibroids.
But just unlucky. Yeah. Yeah. Just unlucky. By the book. You can't
Wow.
tell her what to do because she's doing everything. Yeah.
Oh, wow.
She's vegetarian. She's athletic. She did a competition for swimming. She's not the one which you can say, oh, change your lifestyle.
Oh.
You just sit in front of her and you have no answer. Yeah. Mm. Yeah. So
Wow.
these are also the exemption. Yeah. Yeah. Yeah.
Interesting stuff.
So it's not all by the book. It's not all fit with everything we say.
Yes, I get.
Mm.
As with anything in life, you know, but
Mm.
still,
Mm.
we
Yeah.
still stay on the
Yeah.
side of
Yeah.
caution,
Yeah. And I
you
had
know.
two patients similar to each other. They have so many fibroids, and in addition, they have this endometriosis, and they have nothing to change in their life.
Wow.
Nothing to change. Yeah.
That's very
That's
annoying.
sad.
Like
That
you're
is
doing
sad.
everything
You come out
right.
and you don't know what to tell the patient. You just come out and you have no answer.
Mm.
Mm.
Oh wow,
Yeah.
that's
Yeah.
sad. There's
Mm.
another question. How
Mm.
long after a myomectomy surgery can one try for a baby?
6 months.
6 months.
Yeah. Yeah. And depend also on a number of the fibroid removed and how bad the wall and the cavity of the womb is being damaged.
Mm.
Usually the surgeon will tell you, but average 6 months.
And then the womb is ready, properly healed again to
Yeah, 6 months to a year. A year depend on how
a
many
year.
fibroid. If too many fibroid, yeah. If too many fibroid is it damage a lot of tissues around that, so you have to be very careful because when pregnancy growth may open the wound.
Mm. Another thing I wanted to ask, so does scraping or removing, doing the myomectomy, does that reduce the quality of the womb?
Of course, it's removed a lot of tissue from the womb, and that is weakness of the womb. Yeah,
Mm.
and size of the womb, the weakness of the womb. So it's not just coming out like something you take from the floor, like a ball you take it from the floor. It all affects the surrounding. Mm.
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 Wow.
Mm.
Wow. Thank you
Mm.
so much, Dr. Omar.
You're welcome.
We've used our 1 hour very
Mm.
well. This has
Mm.
been helpful for me and
Mm.
informative. Thank you about that sonata treatment,
Mhm.
honestly, you
Mhm.
know, but now we know it's still in the research project
Mhm.
stage in the UK.
Mhm.
Let's see
Mhm.
how far we go with that, but
Mhm.
something that's been offered in
Mhm.
America already.
Mhm.
Great
Mhm.
stuff. Thank you. Thank you. If you're
You're
here for
welcome.
the first time, this is the FHF Support Network. We provide support in our community through having relevant conversations like this one, hand-holding, education,
Mhm.
information, guidance,
Mhm.
you know, just peer-to-peer mentoring,
Mhm.
hand-holding. If you're
Mhm.
going through any feminine health issue, today we're talking about
Mhm.
fibroids.
They
And let's
can
say
just
it could
send question and I'm ready to answer.
be,
Okay? Any
yes, please. And
question
if you have other
if they have?
questions for
Yeah.
Dr. Omar, please send it.
Mm. Mm.
Join join
Okay.
our community and she will answer. We can send it back to you. Is it
Mm.
safe to do a myomectomy with a CS? I don't even know what that means. Do you
With a
answer that
cesarean
quickly?
section. Yeah,
Is it
myomectomy
safe
with
to do a myomectomy
cesarean section.
with a CS?
Not every surgeon is happy to do that, but I did one last year for one girl. She had a fibroid. She was she managed only to go through 36 weeks of pregnancy because the fibroid was so big and she was the slimmest girl in the world. So there was no space to go. So I took the fibroid away also with a cesarean section, but a lot of surgeons, they're afraid to do that because it can cause a lot of bleeding. Yeah.
Mm.
Yeah, you have to be
Just
very careful
complications that's
because
involved.
the womb is enlarged, lots of blood vessel around that. Yeah, but it depends where it is, what is it, and what area it is. Not everyone is touching it, and not everyone is allowed to touch it unless it's in your way. Yeah.
Mm.
So I did it for her. I did it for her, and she was very happy at the end, because the year before she married, and she was in a size 8, the wedding dress, and she didn't know she had a fibroid. But with the pregnancy, it just gone mad. It become another baby size. So she had
Wow.
no space to go. She was size 8 even during pregnancy. So I had to take the fibroid away with the 36-week baby.
Oh.
Yeah, 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 yeah. Yeah, we have seen so many things. It's just like a story.
Oh.
I should put a book.
You
I should
should.
write a book.
You
I
should,
should write
honestly.
one.
You
I'm
should.
lazy of those things. Yeah.
Thank you
You're
so much
welcome.
for your
You're
wealth of
welcome. You're
knowledge and
welcome.
information.
Thank
Someone
you.
says, any advice on surgery to remove a fibroid without open surgery? Yes, we talked about
Yeah,
that earlier.
laparoscopy. Yeah. Yeah.
We
Mm-hmm.
did. So you
Mm-hmm.
have option of laparoscopy, but
Or
if you
hysteroscopy.
wanted to explore other things in America,
Mm.
there
Mm.
is Donata treatment,
Yeah.
everything,
Yeah.
different things for different women. But look it up. Sports
Definitely.
treatment
Yeah.
is like blasting
Yeah. Yeah.
the fibroids, but there's no cut. It's through
Yeah.
the vagina.
Yeah.
So
Yeah.
yeah, there are
Mm-hmm.
various treatment. But
Mm.
it's been time well spent. Thank you so
Thank you
much.
so much. Thank you.
Thank you. If you have further questions, send
Any
us
questions,
messages.
just send it.
Yeah.
Okay.
Rosalind is asking in the UK. No, it's not available in the UK yet. It's a
Not
research
yet.
project.
Hopefully soon. Hopefully soon.
Yeah,
Not yet.
not
Yeah.
yet. It's a research project
Yeah.
currently, but hopefully we get to get the benefit of that as
Yeah.
well in the UK
Yeah.
sometime soon. Yes.
Yeah.
Thank you everyone for
Thank
joining.
you,
And
everyone. Thank you.
thank you. I hope you've learned something today. It's been useful for you, and you've taken away something that can help.
Thank
Thank
you.
you, everyone. Have a lovely, lovely evening. And in December, we're having our Love is Giving. It's something that we do where we give aid to support people, around Christmas. We give away food
Yeah.
items
Yeah.
and good and hygiene stuff. So this year
Yeah.
we're doing, last year we did abroad, but this year we're doing in the UK and abroad. So
Okay.
support us. We will put our link for Just Giving in our bio. Please go and donate. Help us to help other people. Help us to reach more people. Thank
Yeah.
you everyone for joining tonight. I hope
Thank
this has been useful. And thank you, Miss so much.
Thank
Lovely to have you back.
you.
Welcome
And you.
back.
Thank you.
Welcome
Thank
back.
you. Sorry. Thank you. Bye-bye. Bye-bye.
All right. Good night,
Bye-bye.
everyone. Thank you and God bless you. Bye. Thank you, everyone who's joined tonight. I hope you found it useful. I hope you've taken away something for you or for someone else. God bless you, everyone. Have a beautiful evening.